And now on the line is Global Health and HIV Consultant Breda Gahan. Breda worked with Concern Worldwide for 35 years up until recently and is still working as a consultant. And she is no stranger to this programme on Near FM, going back the last 10 years this year. Breda, welcome back to Near FM.
Thank you, Darren, and hello to all your important listeners on Near FM.
Okay, cool. Thanks, Breda. Breda, you retired from Concern Worldwide a few months ago, but I understand you are still doing some consultancy work. Can you just tell our listeners a bit about what you are doing now since you formally retired from Concern a few months ago?
Yes, Darren, from the middle of last year I moved on from Concern after 35 years, and really it has been desk-based consultancies up until the end of last year. I was rapporteur at the Irish Global Health Network Conference in, I think it was October last year. I delivered a John Keaveney lecture. I was asked to document the conference report. I also developed an e-module on HIV in public health and delivered a lecture at Maynooth University at the end of the year on public health in emergencies. And then some of us with you, Darren, in December with the World AIDS Day interviews and articles. And I contributed to the story of HIV and AIDS in Ireland documentary, which is still on the RTE player at the end of November last year. And literally as this year is beginning, and it feels longer, we're only in February still, but I've been following the abrupt, as you mentioned, are going to mention USAID and PEPFAR cuts authorized by President Trump's team, and the impacts we're learning about or considering on global health and HIV, and now the knock-on effects already with proposed UK aid reduction. I'm stunned to read just in the last week or so that Britain is cutting its foreign aid from 0.5% to 0.3% to increase its defence spending because of, as they say, new threats in Europe since Russia invaded Ukraine. And they proposed that the private sector would need to be leveraged to step in and help fill the gap. I don't know how realistic this is, but it's like a cascading effect already in terms of the Trump administration cutbacks, announcements happening literally and changing by the day, Darren.
Yeah, okay. It's great to hear, first of all, that you're still doing some great work, even though you formally retired from Concern. And I watched that documentary around World AIDS Day about HIV in Ireland. It was very good. I think it's on for an hour. I watched that. It was very good. And you're talking there about, I didn't actually know about UK aid until you mentioned it before the interview. And as the main reason I got in touch with you for this interview was to talk about USAID. And as you say, the story is evolving on a day-by-day basis. This might be a big question, Breda, but before we talk about some of the implications of USA ending, can you tell me what is your experience of the organisation going back to the 1980s up until before this news with Trump and Musk?
Yes, Darren. Well, USAID, or the United States Agency for International Development, was actually founded in 1961 by a friend of Ireland, the former, sadly deceased President John F. Kennedy. And it's an independent agency of the United States government responsible for delivering overseas aid, including humanitarian emergency response and development assistance ever since then. I've known USAID in terms of my work with Concern and supporting jointly programs with Irish Aid and other donors in global health, HIV and AIDS disaster relief, socioeconomic development and cash assistance, climate, environmental protection, governance, peace, work and education projects. And with an annual disbursements of approximately 23 billion since 2001, USAID has been one of the largest aid agencies in the world and accounts for most US foreign assistance, the highest in the world in absolute dollar terms. USAID has missions in over 100 countries, and I've known the country offices in many of the countries I've worked, especially in Africa and Asia and the Middle East. I have with concern supported USAID child survival programs in Bangladesh, Ethiopia and Rwanda in partnership with other US international organizations like American Relief and others, local concern teams, local organizations, and importantly, all in collaboration with host government ministries of health in these countries. So it's been a great learning experience for me in terms of quality, rigor, doing quality, baseline and endline surveys, evaluations to measure the impact of our investment and to see the progress, particularly of child survival programs I've worked on in Bangladesh and Rwanda.
Okay, this is another big question, Breda. You've already kind of answered it somewhat already, but can you tell me about your and your colleagues' level of shock when Donald Trump and Elon Musk announced a few weeks ago that they are going to end USAID?
Well, shock and still shocked, Darren. The United States remains one of the richest countries in the world in 2025. Who can fill this huge funding gap? The freeze in HIV response program, including PEPFAR, and we'll talk about that later, is estimated to jeopardize treatment access for life-saving antiretroviral treatment for 20 million people, including 500,000 children. And the deputy director at UNAIDS last week estimates that there could be a 400% increase in AIDS-related deaths around the world if PEPFAR is not formally reauthorized for USAID funding. I've said many times talking with you, Darren, around World AIDS Day, HIV and AIDS are technically 100% preventable. We can't allow a resurgence of a killer disease that is treatable in northern countries, including in Ireland.
Can you remind our listeners, Breda, as to who PEPFAR are, and tell me if they are definitely kind of included as regards USAID aid, or are they separate, or what's the story? PEPFAR. Yeah. It's another acronym. The United States President's Emergency Plan for AIDS Relief was actually launched by former President George W. Bush in 2003, so 20 years ago. It's global health funding to respond to the global HIV and AIDS epidemic. And by 2023, PEPFAR had reportedly saved over 25 million lives, principally in sub-Saharan Africa. At the end of January this year, just gone, the Trump administration put the program on halt and took away PEPFAR's computer systems online and their surveillance programs. On January 28th, the new government granted a waiver then for essential medicines, AR antiretroviral medication, and medical services, temporarily restoring a global HIV treatment program which had been suspended the previous week. But processing waivers is very bureaucratic, time-consuming, and administratively demanding for international organizations like Concern and local organizations in country. As of now, the majority of USAID-funded prevention programs for people at high risk of infection, including adolescent girls and young women and key populations, remain closed. And like I've said many times, the cost of HIV treatment for life is much more expensive than HIV for prevention everywhere. Of the almost 40 million people living with HIV globally, nearly 10 million are still not accessing life-saving treatment. And we discussed this on World AIDS Day, December 1st, just past, Darren. 630,000 people died of AIDS-related illnesses last year. And
1.3 million people around the world became newly infected with HIV. Newly infected people, including here in Ireland. And in 28 countries, as of today, the number of HIV infections is on the rise. The impact on young women and girls, is especially stark in terms of their vulnerability. And every day in 2023, 570 young women and girls aged between 15 and 24 acquired HIV. With the pause in investment by USAID and PEPFAR in HIV prevention programs, young women and girls are increasingly at risk of acquiring HIV, especially in conflict and poverty-affected countries like Democratic Republic of Congo at the minute, Sudan, Haiti, Burkina Faso, and others. It's unconscionable to think that poor progress had been made in terms of PEPFAR and other donors halting the spread of HIV and halting AIDS-related deaths. This might now be dramatically reversed, Darren.
Yeah, just about PEPFAR. This goes back several years because I understand he doesn't do many interviews in the media nowadays. But I saw George W. Bush interviewed on television a few years ago now. And I think he said that PEPFAR was his number one foreign policy global achievement that he was most proud of. And I find it astonishing that when so much progress has been made, instead of building on that progress so that everyone who has HIV has treatment, I find it astonishing that even what's been achieved could be pretty much destroyed, because that's what it's looking like, isn't it, Breda?
Absolutely, Darren. And many Republicans do not agree with the current administration's position on this, and in terms of, protecting and saving lives. Like, soft power in terms of aid assistance is valued in so many countries globally, from A to Z, as I often say, Afghanistan to Zimbabwe. And poorest and most vulnerable people will suffer and endure hardship most, like I said, in Democratic Republic of Congo, Haiti, Mozambique, Tanzania, Zambia, and Uganda, which are most affected by the downturn or pausing of USAID funding. Countries I've supported with concern during my time, and I'm concerned that essential frontline health workers in some of these countries now will not be paid and therefore unable to deliver essential, life-saving health and HIV services, including maternal child health services and child vaccination for the 6 diseases. Measles has emerged again in the US. Infectious diseases do not stay within countries. They easily cross borders. It's in everybody's interests to invest in disease surveillance, protection, prevention, and containment and treatment.
Okay, Breda, we are recording this interview on Thursday the 27th, and we broadcast on Tony's programme on AirFM on Sunday. Can you tell me if you have any level of insight into what the next few weeks and months are going to entail in terms of USAID and PEPFAR possibly ending?
The suddenness of the funding cuts has been heartbreaking, Darren, thinking of the poorest people who rely on USAID for life-saving health and protection services. And like I said, development aid remains a very important soft power tool globally. And many northern countries, including the US, have been enriched from their historical activities and ongoing activities in many now still low middle income countries. It's staggering for me that this has happened so suddenly and abruptly. And the latest UNAIDS weekly update, which was yesterday, on the impact of US funding freeze on the global AIDS response is that civil society and community-led outreach services will be hardest hit. I mean, in Tanzania, where I did my HIV prevention-related master's research in 1994, young people working as peer educators, community health workers, and lay counsellors funded by PEPFAR have been issued with temporary job termination notices. In Kenya, where Concern has a program supporting health and the HIV response with USAID and other donors, including Irish Aid, many of the civil society organisations engaged in the AIDS response have had to lay off staff and close. People living with HIV and key populations who access the services are being redirected to other services, often far away, transport costs, food costs, and many of them may give up on accessing their treatments. Likewise, in Kenya, diagnostic services for TB and HIV have been interrupted and come to a standstill. Again, TB, as I say, is a travelling disease, just like HIV. All infectious diseases are literally, these days, a train, plane, bus, car drive away. In the Ukraine, you know, in that part of Europe, PEPFAR has been supporting ARVs, and treatment remains uncertain now, as they only have antiretroviral medication up until March 2025. But, I mean, the uncertainty and unpredictability is very concerning. Like I said, people will die from undiagnosed and untreated, treatable illnesses. There are greater needs for humanitarian response now, with over 20 million plus refugees and nearly 50 million internally displaced people globally. Sadly, often resulting from conflict in African countries and as a result of climate change, particularly in Asia. There are about 120 million people globally displaced at the minute, Darren, 1 in every 69 persons on this planet. More investment in defence rather than development, I think, is not a good move, politically or economically. It will likely increase global migration and hardship, for often the women and children left behind as the men travel for work opportunities and income to send remittances and money back home. Poverty, hunger, conflict, climate change, and human rights violations are the main drivers of people trafficking and male migration to safer, stable economies for income. I just read yesterday again that the Trump administration is cutting 90% of USAID foreign aid contracts. Who will step in? And like I said, I think Irish Aid needs to lead by example, the Irish government, to continue funding emergency and development aid in the countries we've been supporting with Concern and others. And it was good to hear that in the latest budget, the government pledged an extra $35 million to support Irish Aid's work in countries worst affected by poverty and conflict. Conflict has to end in Ukraine, in Palestine, in DRC, in Sudan, in Haiti, in terms of local violence. You know, we probably need peace marches again. Concerned with our partners in Irish Aid, DOCUS, COLAF, the Irish Global Health Network, Alliance 2015 European Partners, and the US core group I've been working with on child survival programs. Now we need to collaborate more than ever this year until the Trump administration is hopefully supported to change course or ends in 4 years' time.